One of the driving factors for joining the clinical trial was to help people that were going to go through what I'd gone through in the future, and I think that anything I could do to make anything better, you know, for people who were being diagnosed and treated. Yeah, and obviously somebody had done the same and I'd benefited. So yeah, I think it's all about giving back if you can. My name's Julie, I'm 60 now and I was diagnosed with lung cancer when I was 59. And it was quite a late diagnosis, so it was stage 3. I didn't know much about cancer, but I knew if it had been a 1 or a 2 it would have been a better. And then it wasn't the best kind of cancer to get, not that there's a good kind of lung cancer, but small cell is, as I found out, particularly bad. And it just went on and on. There just seemed to be bad news after bad news. It was like an earthquake inside me. On one level I couldn't even take it in, it was just so horrible. And then it just felt like I'd been took out of my real life, kidnapped and put in a horror movie. I remember wondering how anybody ever got to terms with something like this and managed to get back to any kind of normality. And I'd heard of the Maggie centres, so I did actually go in. I just walked in, I didn't know what I was going to do, and I spoke to one of the cancer specialists there, and from that minute my life really did change. She said things like, well, once you start your treatment you'll start focusing on that. And at the time she suggested I joined a lung cancer support group, but I was absolutely too scared. I was too scared to join anything to do with lung cancer. And she asked me why, and I said, well, I just think it's going to be lots of wheezy old men on oxygen. And she said, please just try it once, you're going to get a real surprise. And that was the real turning point. It was on Zoom at the time because of the coronavirus. But I zoomed in this particular day and it was several feisty women. We go out together sometimes now and we always laugh and say, if we said to anybody, what's the common denominator, they would never say you've all got lung cancer. So that was a big turning point. And also the big thing for me was there were some long-term survivors amongst these lovely ladies, because I just thought, I've got lung cancer, I'm going to die. And once they said it was stage 3, they got me booked in for treatment, and it was concurrent chemo radiotherapy, which is apparently quite gruelling and brutal. So I had 30 sessions of radiotherapy and 4 rounds of chemotherapy, so that were 12 sessions. Unfortunately, I pretty much sailed through it, but I was very, very lucky. Yeah. Okay. And I think because I was so well when I was diagnosed, I think that helped as well. I think a turning point was when all my hair fell out. So they warned me that would happen, and they warned me when it would happen, and I decided to get a friend to shave it off. Yeah, I couldn't bear the thought of hair coming out and finding it all over the place, so I got my friend to shave it off. And I thought I was going to be fine, but then when I looked in the mirror and this bald woman looked back at me, then I saw myself as a cancer patient, and for some reason that really hit me. Yeah, I couldn't even look at it. As soon as I got up in the morning, something went on my head and I couldn't touch it neither. So washing my scalp, I just used to get a face cloth. Yeah, that was horrible. I hated it, and I knew that people were looking at me and think as a cancer patient. Yeah. After the treatment, I did have a scan and there was no evidence of the disease. Then I decided to go into a clinical trial. I discussed it with my consultant and was advised, yeah. So I signed all the paperwork, and it happened really quickly. I think I'd finished all my treatment by the end of April, and then May I went into the clinical trial. The clinical trial that I'm on it's called the Adriatic trial, and it's an immunotherapy drug that's been used successfully on a different type of lung cancer. And it's quite a late stage trial. I've been on it about 1.5 years now. It's gone really, really quick, I have to say. Yeah, in a way I quite like the routine. I go on a Monday and a Tuesday once every 4 weeks, and on the Monday I have blood tests, see the doctor, and then on the Tuesday I go and have the infusion. So even the doctor doesn't know if it's the placebo or if it's the immunotherapy. So I can stay on it for up to 2 years, providing the cancer doesn't progress and I don't get any side effects. So I think I've still got about 7 months to go. And then at the end of it, they will unblind it. And if I was on the immunotherapy and it's kept me well, then I believe I can stay on the drug. So again, that'll be another bit of anxiety, waiting for that. I try and not harp on and not keep on about that I've got lung cancer, you know, that I'm okay, but I've just had this cancer. But that's not everything in my life. I've just moved into a nice little flat. I do try and go on holidays and days out, and I've got my cancer tribe. And we have such a laugh. I mean, you couldn't believe that all these people with lung cancer would have such fun, but we do have a great time and we meet up and go for meals and things. Sometimes I quite like going on a holiday or little mini breaks on my own and to a place where people don't know that I've got lung cancer and they just treat me like everybody else.